So this year, ESMO Gastrointestinal Cancer Congress, we presented a 3-year survival rate of TOPAZ-1 study in biliary tract cancer. So, in the TOPAZ-1 study, the primary analysis, which was done at 2021, demonstrated that the Durvalumab plus gemcitabine significantly improved overall survival compared to the placebo plus gemcitabine. At the time, OS hazard ratio was 0.80 and with an acceptable safety profile. So with that, the Durvalumab plus gemcitabine became a new standard of care for first-line advanced biliary tract cancer patient. So this year, we presented updated survival at a median follow-up of 41 months. Actually, this median follow-up 41 months is the longest data set in this field. The data cut was done at October 2023, which was around 3 years after the last patient was randomized. So with this updated follow-up, the OS benefit with the Durvalumab plus gemcitabine has been continued. So now the OS hazard ratio is 0.74, so which is numerically improved from 0.80 of primary analysis of TOPAZ-1 study. So now I say that TOPAZ-1 OS hazard ratio is 0.74. And 3-year overall survival rate is 14.6% in the Durvalumab arm and 6.9% in placebo arm. So 3-year survival rate was more than double by adding the Durvalumab on top of gemcitabine. And interestingly, when you look at this 3-year survival rate by the patient's best objective response, especially in patients who achieved CR/PR response, that is a responder, their 3-year OS rate was 31.9% in the Durvalumab arm, very good number, and 15.6% in placebo arm, so more than doubled. And when you look at the stable disease patient, again, 3-year survival rate was 9.8% in the Durvalumab arm and 5.1% in placebo arm. Again, the 3-year survival rate was doubled. So when we combine CR, PR, and stable disease all together, so the patient who achieved disease control, their median overall survival was 14.6 months, surely longer than the 12.9 months of fast population. And their 3-year overall survival rate was 17% in the Durvalumab arm and 7.6% in placebo arm. In this analysis, we also did a very interesting analysis focusing on extended long-term survivor. So with that, we defined this long-term survivor as the patient who were still alive more than 30 months after randomization. And we looked into their baseline characteristics, and we found that generally these long-term survivors' baseline characteristics were generally quite consistent with fast population. So all clinically relevant subgroups were represented in this long-term survival group, including primary tumor location, gallbladder or intrahepatic and extrahepatic cholangiocarcinoma, or and also region Asia versus non-Asia, and also PD-L1 expression, so high PD-L1 or lower negative PD-L1 population. So it means that those single subgroup drove the long-term survivorship. In the Durvalumab arm, 17% of patients belong to this long-term survivor. So it means when we treat the patients with gemcitabine plus Durvalumab, 17% of patients can live longer than 30 months. However, in placebo arm, 8.7% of patients belong to this long-term survivor. And what about the safety update? So there were no meaningful changes in SAE and treatment-related SAE from previous analysis. In this long-term follow-up data set, the median treatment duration of durvalumab was 7.3 months. When you look at the long-term survivor, their median treatment duration of durvalumab was 17.8 months, quite a long duration of treatment. Despite of longer duration of exposure of durvalumab, the long-term survival group's SAE were quite comparable between arms and even less frequent than patient in fast population. So this updated survival and safety data of TOPAZ-1 study further support use of durvalumab plus gemcitabine as a standard of care for first-line advanced biliary tract cancer. So after a median follow-up of 41 months, durvalumab plus gemcitabine continued to demonstrate clinically meaningful, really long-term survival benefit. Yeah, so already development plus gemcitabine is standard of care, current standard of care. But with this long-term follow-up data set, we can found a really long-term survival benefit with this regimen in this population. And before this phase 3 studies, it was quite uncommon for us to mention about 3-year survival rate in this biliary tract cancer field. But now we clearly say that by treating patient using the durvalumab plus gemcitabine combination, 3-year survival rate is 14.6%. Very interesting data and very important data in this field.